So, welcome again to our course of medical imaging anatomy. We will be continuing with the brain imaging anatomy. Today we will discuss the basal nuclei, the white matter tracts, and we will discuss about the cerebrum. The basal ganglia or basal nuclei comprises multiple subcortical nuclei in the brain that is interconnected with the cerebral cortex, with the thalami, and with the brainstem. Anatomically, these nuclei include the caudate nucleus, the putamen, and the globus pallidus. These three pairs of basal nuclei are called the corpus striatum. And then the putamen with globus pallidus are called the lentiform nucleus. This diagram here shows the relationship between these three pairs of basal nuclei. This is the caudate nucleus, starting from the head, body, and tail, and then ending in the amygdaloid body. This is the lentiform nucleus, which is composed of putamen and globus pallidus. The thalamus is just medial to the lentiform nucleus. Functionally, there are some other basal nuclei, including the subthalamic nuclei. These are also a pair of subcortical gray matter nucleus that lies just below the thalamus, and the substantia nigra. This coronal view diagram of the brain shows the location of the basal ganglia and the basal nuclei. This is the head of caudate nucleus. We knew that caudate nucleus has a curved shape. So what we just see in this section is the head and a part of the tail here. And this is the putamen and the globus pallidus. The globus pallidus is divided into two parts: the external segment or the lateral segment, and the internal segment or the medial segment. These pair of nuclei are called the lentiform nucleus. This is the thalamus. Just below the thalamus is the subthalamic nucleus, and these are the substantia nigra, these black ones, and these are the red nucleus. We'll move on to see the real images, what we will actually see in the real life of medical imaging. This is a brain CT. As we know, the brain CT is not as high resolution as MRI. So it's not that much easy to differentiate these nucleus. But if we focus, we will find that these nucleus are slightly hyperdense compared with the surrounding white matter. They are isodense to the gray matter, to the cortical gray matter. Yeah. We will talk about the normal density and signal of these structures, but here we are just explaining the location of each of these nucleus. So this is the location of head of caudate nucleus. This is the globus pallidus, and just medial to it is the this is the putamen, and just medial to it is the globus pallidus. More medially is the thalamus on each side. This is T1 MR image. We can tell the difference in resolution between CT and MRI, right? Yeah, this is T1 weighted image. We can see clearly the white matter bright and the gray matter darker. So at this location is the head of caudate nucleus. This is the putamen and the globus pallidus here, and this is the thalamus. Later on, we'll continue talking about the other anatomical structure of the basal ganglia. This is T2 MR image. This is the location of head of caudate nucleus, the putamen, the globus pallidus. This pair is called the lentiform nucleus, and the white matter that separates them from the thalamus is called the internal capsule, including the anterior limb or anterior horn of the internal capsule, the genu here, and then the posterior horn or posterior limb of the internal capsule. We need to know the normal density and the normal signal of these basal nuclei so we can tell if there is any abnormality in the density or signal intensity. They are normally isodense on CT and iso-intense on MRI with the cortex, with the gray matter. The globus pallidus appears slightly more hypointense than putamen on T2 weighted image, gradient echo, and SWI images because it has more myelin content compared with the putam. We can come back to the T2 image. We can notice here that the globus pallidus is slightly hypointense compared with the putamen, right? Then some age-related changes of these basal nuclei, including calcium deposition in the globus pallidus. Initially, it results in increased T1 weighted image signal intensity, and subsequently, when the deposition of calcium exceeds 40%, it then loses the signal in all sequences. So it will be dark in all MRI images. Then aging with consequent iron deposition in the putamen results in gradual decrease of T2 weighted image intensity in the putamen. This is more pronounced in patients in their 70s or 80s. So this hyperintensity of the putamen will be lost in all people above 70s or 80s. This is a normal aging change of the basal nuclei. We move on to talk about the major white matter tracts. The major white matter tracts are classified into three categories according to their orientation and the function. So we have the projection tracts, the association tracts, and the commissural tracts. There are some important areas of white matter tracts which we should identify on brain images, include the subcortical U fibers, corona radiata, internal, external, and extreme capsules, central semi-ovally, and the corpus callosum. We will talk on about all of these in details. This is a T2 weighted image. This location here shows the subcortical U fibers. They form U-shaped white matter fibers that connect the gyrus of the cortex of the brain with the adjacent gyrus. And then here we have the corona radiata. This location here is the corona radiata. This is also a very dense area of white matter fibers. This is another image, more superior. This is to show the area of centrum semi-ovally. This is also a white matter tract. This image to show some other areas of white matter, including the corpus callosum. This is the genu of corpus callosum, and this is the splenium here. We will talk about corpus callosum later. And then we have the internal capsule. This is the anterior limb, the genu, and the posterior limb of internal capsule. Here we have the forceps major of corpus callosum. These are also white matter tracts. They are coming out from the splenium of corpus callosum. And here we have the forceps minor. We will see these structures better on tractography and DTI images. The projection white matter tracts, also called the ascending and descending tracts, these are white matter fibers that connect the cortex of the brain with the other areas in the central nervous system, including the deep nuclei, the brainstem, cerebellum, and the spine. So these may be afferent, which are the sensory nerve fibers. These are the nerve fibers that carry the sensation signals from the periphery of the body to the central nervous system. And the efferent with E, these are the motor nerve fibers which carry the commands from the CNS to the periphery of the body. Yeah. So these are called the projection white matter tracts. The association white matter tracts, the second category of white matter tracts, these are white matter fibers that connect different areas in the same hemispheres. They are also called the interhemispheric tracts. So these are within the same cerebral hemisphere, connecting several areas. U fibers is a type of these association white matter tracts, as we told before, that they line one gyrus locally to the adjacent gyri with U-shaped white matter bands. This illustration to show the association white matter tracts. This area here is the U fiber. These are short association fibers which connect the gyri of the cortex of the brain with the adjacent gyri. These are some other association white matter tracts which connect different areas of the same cerebral hemisphere, including the superior longitudinal fasciculus, the uncinate fasciculus, the inferior longitudinal fasciculus, and the perpendicular fasciculus. The third category is the commissural white matter tracts. These white matter tracts are crossing fibers. These fibers are crossing from one cerebral hemisphere to the contralateral cerebral hemisphere. The main and the larger one is the corpus callosum. There are some other commissural white matter tracts, including the anterior commissure, the posterior commissure, the hippocampal commissure, the epinular commissure, and the supraoptic commissure. This illustration shows the major commissural white matter tract, which is the corpus callosum. As we see here, it's connecting a gyrus here, or an area in this cerebral hemisphere, with the corresponding area in the opposite side. So these are the commissural white matter tracts. This illustration also explains how is the orientation of the other white matter tracts, including the projection white matter tracts. These are the ones that connect the cortex of the brain with the other areas of the central nervous system, including the brainstem and all the way down to the spine. So these are the projection white matter tracts. This is a T2 MRI image. It shows some other commissural white matter tracts, including the anterior commissure here and the posterior commissure at this area. How we know that they are white matter? Because they have the signal of white matter. This is the signal of white matter on T2 image. It's darker than the gray matter. The rule is on T1 weighted MRI image, the white is white and the gray is gray. On T2, it's the opposite. The white is gray and the gray is white. This is how to differentiate between white and gray matter and between T1 and T2 MR images. There is an imaging technique called the fiber tractography. This is MRI sequence that use the diffusion concept to detect the white matter nerve fibers. This is a 3D reconstruction technique to assess neural tracts using data collected by the technique called DTI, which is the diffusion tensor imaging. They use color coding for coding different types of white matter tracts, using the red color for fibers crossing from left to right. These are the commissural white matter fibers, right? And the green color to illustrate the fibers that connect the anterior area with the posterior area in the same cerebral hemisphere. These are the association white matter tracts. And the blue for fibers going from superior to inferior. These are the projection white matter tracts that connects the cortex of the brain with the other CNS structures. This is an image of fiber tractography. The one illustrated in color here is the corpus callosum. It connects the same area of different cerebral hemispheres. The projection white matter tracts are these ones that connect the cortex of the brain with the other areas of the central nervous system. And these are the association white matter tracts that connect different areas of the same cerebral hemisphere. Some important areas of white matter tracts, which we already talked about, we illustrate them on the images here, like the internal capsule, the subcortical U fibers. This is an axial DTI image. It shows the forceps minor, which we said that it is the nerve fibers that are coming from the genu of the corpus callosum, the anterior limb of the internal capsule, the genu of the internal capsule, the posterior limb of the internal capsule, and some other white matter tracts. This is the external capsule. This area is the internal, and this area is external. These are the white matter tracts. This is the area of splenia of corpus callosum and the forceps minor. This is the area of anterior commissure and some other fasciculi of white matter tracts. We talk about corpus callosum because it's the largest commissural white matter tract. It's linking the cerebral cortex of the left and right cerebral hemispheres. And in structure, anatomically, it's divided into 4 parts, from anterior to posterior, divided into rostrum, which is continuous with the lamina terminalis, the genu that has the forceps minor, the trunk or the body, and the splenium, which has the forceps major. Some other resources, they add the isthmus, which is this thin structure of the corpus callosum. So from anterior to posterior, it's the rostrum, the genu, which is the one like the knee. The genu means knee. And then this is the body. The most thinner part here is the isthmus, and the most posterior part is the splenium of corpus callosum. This is the forceps minor as detected by tractography, passing by the genu of the corpus callosum. And these are the forceps major, passing through the splenium of corpus callosum. There are some variant anatomy of corpus callosum. The most important one is the dysgenesis or agenesis of the corpus callosum. This may be complete or partial, and it represents an in utero developmental anomaly. It can be divided into 2 types. Primary agenesis, which means that the corpus callosum never forms, and the secondary agenesis or dysgenesis of corpus callosum, it means that the corpus callosum was formed, but there are some subsequent causes that destroyed it. So when we don't have a corpus callosum that connects the cerebral hemisphere with the contralateral cerebral hemisphere, the white matter tract instead is oriented vertically, making some configurations which can be detected by imaging of the brains. And it has some signs such as the racing car sign configuration. This is seen on axial image, and moose head sign on coronal image. This is the moose head appearance of corpus callosum agenesis. This is the area of corpus callosum, but it's absent here. So what we see configuration here is the moose head sign. On axial image, the corpus callosum is supposed to be here and here, connecting the 2 cerebral hemispheres. Now when it is absent, the white matter tracts are oriented vertically, and there is no connection between the 2 cerebral hemispheres. This configuration here is called the racing car sign. This is the body of the car, and these are the 4 wheels of the car. We move on to talk about the cerebrum. This is the largest part of the brain. Cerebrum, or it's called the telencephalon, is a paired structure composed of 2 cerebral hemispheres, left and right cerebral hemispheres, and each of them containing a central space, which is the lateral ventricle. The cerebrum takes up most of the intracranial cavity because it's the largest in size, and it lies above the tentorium cerebelli that separate the cerebrum from the cerebellum. The cerebrum is composed of several structures, including the cerebral hemispheres, a pair of hemispheres, the basal ganglia, where we talked about this one, the olfactory bulb, and the white matter tracts, where we discussed them. And then it is connected with the brainstem via the cerebral peduncles. Starting with the cerebral hemispheres, we have two cerebral hemispheres which fill most of the intracranial cavity. They are lined by cerebral cortex and covered by meninges. These are three layers of membrane, including the pia mater, the arachnoid membrane, and the dura mater. The surface of the cerebral hemisphere is divided by grooves. These are called the sulci. The single is sulcus. And ridges or crests, these are the gyri. The single is called gyrus. The corpus callosum connects the right and left cerebral hemispheres, as we knew previously. Starting with the cerebral hemisphere, which is divided into several lobes. It has four lobes mainly. These are the frontal lobe, the parietal lobe, the occipital lobe, and temporal lobe. Some authors refer to the insular cortex as the insular lobe, and the cingulate gyrus with hippocampus as the limbic lobe. The relation between the cerebral hemisphere with the other structure is like this. Medially, there is the falx cerebri. This is an extension of dura mater that lies within the cleft between the two cerebral hemispheres, separating the two cerebral hemispheres, and the contralateral cerebral hemisphere. Inferiorly, there is the anterior and middle cranial fossa and the tentorium cerebelli, which separates the cerebrum from the cerebellum down. This is the superior view of the brain. The most frontal part is the frontal lobe. The most top part is the parietal lobe. The most posterior part is occipital lobe. Here we cannot see the temporal lobe because it lies more inferiorly, and this is a superior view. Here we can see a very thin membrane, which is the arachnoid membrane that covers the brain, and some cerebral veins and arteries covered by this arachnoid membrane. This is another illustration from lateral of the brain. This is the frontal lobe. This fissure here is called the central sulcus, or fissure of Rolando. This separates the frontal lobe from the parietal lobe. This one in red here is the parietal lobe, and the most posterior one is the occipital lobe. The most inferior one is temporal lobe, which is separated from frontal and parietal lobe by the lateral sulcus, or the fissure of Sylvian fissure. We will talk about each of these lobes in details, starting with the frontal lobe, which is the largest of the four lobes of the cerebral hemisphere. Frontal lobe resides largely in the anterior cranial fossa, lying on the orbital plate of the frontal lobe. Its anterior-most part is called the frontal pole, the most anterior area of the frontal lobe. And it extends posteriorly to the central sulcus, which separates the frontal lobe from the parietal lobe. And posterior-inferiorly, it's separated from temporal lobe by what? By Sylvian fissure, or it's called the lateral sulcus. The insular cortex is more deep within the frontal lobe, and it's hidden deep to the lateral sulcus. This lobe highlighted in yellow here is the frontal lobe. It shows the relation between frontal lobe and the other structures. So it lies within the anterior cranial fossa, just above the orbital plate of the cranium. This is parietal lobe posteriorly and temporal lobe inferiorly. These are the sulci of the frontal lobe. We have the most superior one is called superior frontal sulcus, and the inferior one is called inferior frontal sulcus. And the sulcus that just lies anterior to the central sulcus is called precentral sulcus. These three sulci are dividing the frontal lobe into several gyri, which are the superior frontal gyrus, the middle frontal gyrus, the inferior frontal gyrus, and the one just anterior to the central sulcus is the precentral gyrus. We thought that the most anterior part of the frontal lobe is called the frontal pole, and the gyrus of the frontal lobe that lies on the orbital plate is the orbital gyrus. So if we just remember the locations of these sulci, we can remember the corresponding gyrus, right? So we have superior and inferior, which makes superior, middle, and inferior gyri. And we have the central sulcus. So what is anterior to the central sulcus is the precentral sulcus and central gyrus. The one that lies on the orbital plate is the orbital gyrus. The most anterior part is the pole. We always call most top part or the most lower part is the pole, right? Yeah. The blood supply to the frontal lobe is via the middle cerebral artery. This supplies mainly the lateral area of the frontal lobe, and the anterior cerebral artery, which supplies the medial frontal lobe. This illustration shows the blood supply to the frontal lobe. So this area is all the frontal lobe. The most anterior part is supplied by the anterior cerebral artery, and the most lateral part is supplied by middle cerebral artery. The medial part is supplied by the anterior cerebral artery. The second lobe is the parietal lobe. This is located between the frontal and occipital, and it occupies only about 25% of the cerebral hemisphere. It extends from the central sulcus anteriorly, which separates the frontal lobe from the parietal lobe, to the parieto-occipital sulcus, which separates the parietal lobe from occipital lobe. And the lateral sulcus separates the parietal lobe from the most lower part, which is the temporal lobe. Medially, it is confined by the medial longitudinal fissure. This is the midline, which divides both cerebral hemispheres. This illustration shows the area of the parietal lobe and the relation with the other cerebral hemisphere lobes. So it lies posterior to the central sulcus, superior to the lateral sulcus, and posteriorly is the parieto-occipital sulcus here. The parietal lobe sulci include the postcentral sulcus, the one that just posterior to the central sulcus, the marginal sulcus, and the interparietal sulcus. This is the one at the middle of the parietal lobe. These three sulci dividing the parietal lobe into postcentral gyrus, superior parietal gyrus, and inferior parietal gyrus. Feel free to stop me if I'm fast or there are a lot of details.
Okay, first slide.
So this one, yeah. So the one that is posterior to the central sulcus is postcentral sulcus, right? Sulcus. And the marginal one is the one that lies on the margin of the cerebral hemisphere. The one at the middle is the interparietal. So we have three gyri: postcentral, superior, and inferior. The blood supply to parietal lobe is via the three cerebral arteries: anterior, middle, and posterior. The anterior cerebral artery supplies the medial part, the middle cerebral artery supplies the lateral part, and the posterior cerebral artery supplies the posterior medial part. This is the location of parietal lobe. So laterally we have the middle cerebral artery, posteriorly we have the posterior cerebral artery, and on the medial surface it is the anterior cerebral artery. The third lobe is the occipital lobe. This is the most posterior lobe of the brain, and it lies underlying the occipital bone, the cranium, overlying the tentorium cerebelli. This is the dura mater extension, which separates the cerebrum from the cerebellum. Its most notable function or functional component is the primary and secondary visual cortex. Occipital lobe is separated from the parietal lobe by the parieto-occipital sulcus. We already saw this sulcus. And on the lateral side, by the lateral parieto-temporal line. This is an imaginary line extending from the preoccipital node to the parieto-occipital sulcus. The tentorium cerebelli downward, which separates it from the cerebellum. So this is the occipital lobe. This location here is the parieto-occipital sulcus, which separates it from the parietal lobe, and the extension of this sulcus is this imaginary line. Yeah. Sorry. Yeah, which is the lateral parieto-temporal line, which is extension of the parieto-occipital sulcus. Here we have the parieto-occipital sulcus here and its extension. This is the notch, pre-occipital notch, and this is the lateral occipital sulcus. So the gyri of the occipital lobe include the superior, the middle, and inferior occipital gyrus. This is on the lateral surface. On the medial surface, we have the lingual gyrus and the cuneus. This is the parieto-occipital fissure, extension of the parieto-occipital sulcus on the medial surface of the occipital lobe. The blood supply to the occipital lobe, as it lies in the posterior cranial fossa, so the main blood supply is by posterior cerebral artery. This is the location of occipital lobe, so it's supplied by the posterior cerebral artery, laterally and medially. Finally is the temporal lobe. The temporal lobe extends superiorly to the sylvian fissure, the lateral sulcus, and posteriorly to the imaginary line that separates the temporal lobe from the occipital lobe. The middle cranial fossa forms its anterior and inferior boundaries. The temporal lobe is divided into two main sections. These are the neocortex and the mesial temporal lobe. The neocortex, sometimes referred simply to the temporal lobe, it includes the lateral and inferolateral surfaces of the temporal lobe, and it comprises the standard cerebral cortex. The mesial temporal lobe is the medial part of the temporal lobe. Sometimes it's called the limbic lobe. It's including the hippocampus, the amygdala, and the parahippocampal gyrus. This is the location of neocortex, the temporal lobe. It's separated from the frontal and parietal lobe by the sylvian fissure here, and from occipital lobe by lateral parieto-occipital line, this imaginary line, which is extension of the parieto-occipital sulcus. The sulci of the temporal lobe include superior and inferior. The sylvian fissure or the lateral sulcus is the most superior border of the temporal lobe. So the gyri of the temporal lobe include a superior, middle, and inferior. The most anterior part is the temporal pole. On the medial inferior surface is the fusiform gyrus, which lies between the collateral sulcus and the occipito-temporal sulcus. This one highlighted in blue here is the fusiform gyrus. The second section of temporal lobe is the mesial temporal lobe. This is located on the medial aspect of temporal lobe. This term, mesial temporal lobe, encompasses 5 structures, includes the amygdala, the hippocampus, the dentate gyrus, the parahippocampal gyrus, and the ancus, which is the most anterior part of the anterior parahippocampal gyrus. The most inner part of the anterior parahippocampal gyrus. This is the T2 MRI image in coronal view, shows the location of mesial temporal lobe here. The blue arrow shows the location of hippocampus, and this is the parahippocampal gyrus. This small CSF cleft here is the collateral sulcus, and inferiorly is the tentorium cerebral line, which separates the cerebrum from the cerebellum. On the sagittal image, this is the location of amygdala. This is the hippocampus, head and body, and this is the parahippocampal gyrus. This is an axial image. This is the location of hippocampus, and the innermost part is the uncus of temporal lobe. The temporal lobe is different from the other three lobes because it's supplied by the two cerebral blood supply, which is the internal carotid artery system and the vertebro-basilar artery system. The internal carotid artery system gives the anterior choroidal artery and the middle cerebral artery, which supplies the temporal lobe, and the vertebro-basilar system supplies the inferior surface of the temporal lobe through the temporo-occipital artery. Finally, the last structure of the cerebral hemisphere is the olfactory bulb. This is MRI image on axial view, sagittal view, and coronal view, shows the location of the olfactory bulb. It lies just inferior to the frontal lobe. This is all about the cerebrum, and next time we will be discussing the cerebellum. Thank you.